We need to go to the hospital for injections after we get sick. Very troublesome. So, I invented this automatic injection robot. The design is very human. Because I am not sick, let my good friend demonstrate. The first step, disinfection. The second step, injection. His illness has healed. Very easy to use.
Oh my gosh!
How to stop your period for an emergency. 2 shots of squeezed lime juice, Tajin powder, salt for flavor.
Guys, I had to come back to give you an update because holy guacamole, it works. Okay, I was skeptical. It worked for a day.
So this video went viral on TikTok because apparently people believe that drinking this concoction could delay their period. There is absolutely no truth to that. There's nothing that you can eat or drink that has been scientifically proven to cause your period to be delayed by a day or 2 or even more. Now, obviously there are medications that can do that, but not a drink like this. How do you get your lips this massive? Well, this woman, who's from Eastern Europe, has decided that she wants to have the largest lips apparently in the world. And so she has had injections of filler to make her lips larger and larger and larger. Now, the key to good plastic surgery, or good holistic plastic surgery, is that we only do procedures that we believe will help make that person look and feel better. If you're just making somebody look different for the sake of looking different, I just don't think it's the right thing when you're talking about invasive medical procedures. And that, I think, is the key. Would you believe me if I told you that these videos are real? Yes, they are 100% real. This does happen. However, these videos are reversed. So you start with a Q-tip over here on the back of your neck, and then you move it towards your ear, then towards your cheek, and then you reverse the video, and hence you get what you saw there. These TikTokers, they are so tricky.
My nose 1 year ago.
Oh, helvete.
That is a ton of packing that was in that guy's nose. So how does it feel like when this packing is removed? Well, back when I used to do a lot of nose jobs, my patients would tell me that when we took the packing out of them, that it would literally feel like it was coming out of their brain. My guess was that he had some type of trauma. Either he was in a fight or he was in a car accident. He probably had significant bleeding coming out of his nose, and they packed it full there to try to prevent that bleeding from continuing. So this beautiful woman appears to have lost a ton of weight, great for her, but leaving her with a lot of extra skin. Now, it looks to me that she had a brachioplasty. That's a surgery where you move the excess skin of the upper arms. It does leave, as you can see on her, a permanent scar from the armpit to the elbow. She also looks like she had what's called a fleur-de-lis abdominoplasty, or a fleur-de-lis tummy tuck, where the excess skin is removed from the tummy, giving her a scar that goes from hip to hip and a scar coming all the way up. Now, it's called a fleur-de-lis because the skin is removed in the classic fleur-de-lis shape. This is a French term for kind of like a clover leaf type of a shape.
This better be worth it. I haven't worn sandals in days. All of the skin I lost. Looks like kettle-cooked chips. Day 12.
Now, this is most likely a result of a foot peel that she may have bought online. You can go online and buy these foot peels where essentially there is acid that they put into the little bag. You put your foot into the baggie, it gets impacted and treated by that acid, and over the ensuing several days, the skin of your feet start to peel off. Now, I'm not a podiatrist, but to me, seeing this type of skin peeling, if that was off of a face that somebody bought online, I'd be very, very worried that that person could end up with significant scarring. Definitely discuss it with your doctor first. Are these muscles real? No, they're not. Most likely he had them injected with a type of oil called synthol. This is an oil that you can inject into muscles or into the tissue around the muscles that cause your muscles to look like they're bigger. Well, they may look bigger, but they're not actually bigger, and they're definitely not stronger. And there are major risks that come with oil injections like this. You could get infections from it, you could get scar tissue, you can get inflammatory reactions, you could end up even potentially losing the body part that you inject that oil into. He may actually be stronger had he not had the oil injected into his muscles. And that's because that oil could potentially damage the muscles, making them weaker than they otherwise would be.
I'm going to show you what I wear when I have a patient who is positive for COVID. I do have to wear an N95 mask or a PAPR. When I use an N95 mask, I have to wear goggles. And I also wear a gown and gloves. When I do have to leave the room, I have to dispose of both items and put new ones on. I 100% prefer to wear a PAPR if they're available because they keep your head cool.
I have so much admiration and respect for my medical colleagues who are on the front lines dealing with this pandemic. As you can see, they have to really gown up, and you might not notice, but when you put those gowns on, the yellow ones, I actually have some of those in my office that we used early on in the pandemic when I was seeing patients. They are so hot. Just wearing one of those for 10 minutes while you're seeing a patient, when you peel that off, your whole body is sweaty, and quite often even your shirt is soaking wet. So I want to say thank you. Now, it's easy to say thank you to doctors and nurses. We say thank you to them all the time, but there's so many other people behind the scenes and treating patients, and that are so necessary to the healthcare system for it to run. People like respiratory therapists who've been totally on the front lines of this whole pandemic. People like cleaning crew, people like nurses' aides, nurses' assistants, pharmacy staff, pathology staff, people who are in central processing, people who are in patient registration, people who are there at the front desk to meet people who come into the hospital to tell them where to go to see your relatives. And there's so many others who deserve credit for all the work that they're doing to help keep this country healthy and safe. As a fellow healthcare professional, I want to say thank you. All right, so whenever I react to TikTok videos, we always end up by watching two of mine. Let's start with the first one. Isn't it true that you can die if you get kicked in the balls hard enough? M. Schleicher from Piss in 1843 related a case where a guy was kicked in the balls, he had violent convulsions, and he died within minutes. But was it a head injury that killed him? This guy was charged with murder after kicking his stepbrother in the balls, who died a month later of gangrene. And a Cleveland man was indicted for murder after repeatedly kicking his victim in the balls as he was robbing him, and he died of gangrene. So although getting kicked in the balls hurts, it's unlikely to actually kill you, and it's less painful than childbirth. It's so funny. There is this debate online about what is more painful, childbirth or getting kicked in the balls. And of course, all the guys say, no, getting kicked in the balls is worse. Women obviously will say childbirth is much worse. And there actually are studies that do show that childbirth technically is more painful than getting kicked in the balls. My girlfriend won't go on birth control, and I don't use condoms. So what should I do, doctor? Well, the first thing you should do is take a pair of scissors and cut that Sherwood forest of pubes down. That way the rubber's gonna fit your tiny little willy much better. I want my girlfriend to get breast implants, but she won't pay for them. Take your 2 fingers and pinch your nipple with them. Then twist really hard and pull on it. Your eyes are gonna water, they're gonna get real blurry, and your woman's breasts are gonna look much bigger. My wife is upset that I flirt with teenage girls, like it's a big deal. How do I make her okay with it? What the fuck is wrong with you? I told my girlfriend that she's only allowed to wear thongs from now on, but she continues to buy bikini bottoms. What do I do? Whenever I feel that way, I take the back of my underwear, I climb a ladder, I hook it on the back of a hook like this, and then I jump off. And that makes me know how it feels like to wear those. Yes, I had to ruin a perfectly good pair of Valentine boxers with hearts on them for this video. Now, this last part of the video was inspired by a story back in high school where a buddy of mine who liked to give other people wedgies all the time ended up getting a wedgie himself so bad that his underwear was so stretched out that he had to throw it out afterwards. And so that came to mind while I was making this video, and hence that last scene. Do you like watching TikToks? If you like TikToks as much as I do, take a peek at this playlist right up here where I react to various TikTok videos. These are ones that are going to make you laugh, make you cringe, and even make you learn a few things. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.